Hey everybody, this is Dr. Randon Hall with The Injury Source, back with another educational video for you guys. Today I'm going to talk about looking at a simple elbow x-ray. A lot of times we see a lot of these athletes with elbow injuries, or you may have one yourself and have an elbow x-ray. I just want to go through that and give you a little bit of explanation on what the physician might be looking for. So starting at the initial x-ray, what you're going to be looking at is first what's called an AP view, or an anterior to posterior view. Basically, this is a front to back view where you're looking with the patient with their arm fully extended if possible. Going through the parts of the elbow, this is going to be your medial aspect of the elbow called the medial epicondyle. This is your lateral aspect of the elbow called the lateral epicondyle. Here is your radial head. This is your radial neck. This is the coronoid process of the olecranon, or the proximal ulna aspect of the elbow. That's kind of the basic anatomy there. This is a normal AP view of the elbow. You definitely want to have at least 2, if not 3 views of the elbow to get an accurate assessment. What you're seeing here is muscle, soft tissue, fat, soft tissue, which is also normal. Next up is what we call a lateral view of the elbow. Here is the upper arm, or the humerus bone. Here is your radius bone as well, and this is your ulna, and you have your olecranon here. This is the tip of the elbow that you can easily feel. A couple things that I'd be looking for on a lateral view of the elbow. What I'm going to do is draw a straight line down the front of the elbow, or the front of the humerus rather, that goes directly through this circular portion right here called the capitellum. That's going to tell me that there's no fracture that's caused the elbow to be bent backwards. Additionally, what I'm going to do is look down the canal of the radius bone here and make sure this radial head points directly at the capitellum as well. That's going to tell me that I do not have a radial head that's dislocated, which can be easily missed. Next up is a pediatric elbow. So this elbow is a little bit different because if you're not familiar with pediatric elbows, you're going to think that this portion right here is a fracture of the elbow. This is actually the normal olecranon growth plate that should be present in about 9-10 years of age, depending on if it's a male or a female. Here you can see the radial head growth plate as well. This is the humerus bone. Again, looking at the front, I'm going down an anterior humeral line that should go through the middle of this capitellum. In younger patients, it may go through the middle 1/3, and then the radial capitellar line that shows that the radial head is not dislocated. This is probably your most classic x-ray that you'll see for patients with a subtle fracture to the elbow. If you look closely, this is another anterior to posterior view. You can see you have your medial epicondyle here, lateral epicondyle here. But if you look closely, you will see that there's a lucency or dark line that crosses the radial neck, and that's consistent with a non-displaced fracture of the radial neck. What you may see is other fractures, such as at the coronoid process or a supracondylar fracture, but a radial neck fracture is the most common fracture in an adult pattern. This is a lateral view showing a olecranon fracture of the elbow. In this particular case, what is of note is that the fracture goes all the way up to the joint line here. That's when things can be a little bit more difficult, because increased space at this joint line will cause there to be improper healing and develop arthritis, or not a smooth flexion and extension at the elbow. Usually the cutoff is about 2 millimeters, so this would be appropriate to treat non-operatively, but you would have to watch it very closely. And this picture also brings up an additional area that I would be looking for to ascertain if there is a fracture within the elbow. If you look very closely, what you will see is there is this darkened area along the posterior or back portion of the humerus bone. This darkened area, compared to the soft tissue around it, that is called a posterior fat pad. In a posterior fat pad, that is basically swelling, either inflammatory swelling or bleeding within the elbow, that causes this fat pad to show up on x-ray, which is consistent with something that is going on in an intra-articular fashion within the elbow. So for example, in a pediatric patient with no clear fracture seen, if I see a posterior fat pad, I am going to assume that that patient has some type of fracture if there was a trauma. Additionally, you will see that there is a very subtle anterior fat pad present on this elbow x-ray as well. One thing to note is a anterior fat pad is normal, but an elevated fat pad that sticks out kind of in this triangular fashion, that would be abnormal. That's also referred to as a sail sign, as it looks like the sail of a sailboat when it's quite large. The last x-ray of this video is depicting an elbow dislocation. In this particular case, if you were to draw an anterior humeral line down the front of the humerus, you will go through the capitellum. However, if you draw a line through the shaft of the radius, it clearly does not line up with the capitellum. Therefore, you know that your radial head is dislocated. Additionally, the distal humerus should sit nicely in the curvature of this olecranon, and it does not. Therefore, both the radial head and the proximal ulna are dislocated. You can also note that the radial head appears compressed and displaced, consistent with a radial head fracture as well. So in this case, the patient has an elbow dislocation with a radial head fracture. This is just a quick preview of some of the things that a physician may be looking for on a simple elbow x-ray. Obviously, if there's some more soft tissue concern, then you would move on to an MRI. However, for the interest of time, we'll just review x-ray today. I have other videos available going over looking at an MRI of a knee that might be interesting to you as well. Check us out at The Injury Source on Twitter and TheInjurySource.com on the web.